Hello and welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's top health highlights. Researchers warn about rising cancer cases among adults under 50 years of age. In recent decades, an increasing number of people under the age of 50 are developing cancer, according to a study undertaken by Brigham and Women's Hospital researchers. The incidence of early onset malignancies, those detected before the age of 50, including cancers of the breast, colon, esophagus, kidney, liver, and pancreas, has substantially increased around the world, with this drastic rise beginning about 1990. Scientists undertook thorough studies of accessible data in the literature and online, including information on early life exposures that may have contributed to this trend in order to explain why many younger people are being diagnosed with cancer. The findings of the research were published in Nature Reviews Clinical Oncology. Analyzed global data describing the incidence of 14 different cancer types that showed increased incidence in adults before age 50 from 2000 to 2012. Then the team searched for available studies that examine trends of possible risk factors, including early life exposures in the general populations. Finally, the team examined the literature describing clinical and biological tumor characteristics of early onset cancers compared to later onset cancers diagnosed after age 50. In an extensive review, the team found that the early life exposome, which encompasses one's diet, lifestyle, weight, environmental exposures, and microbiome, has changed substantially in the last several decades. Thus, they hypothesized that factors like the westernized diet and lifestyle may be contributing to the early onset cancer epidemic. The team acknowledged that this increased incidence of certain cancer types is in part due to early detection through cancer screening programs. One limitation of this study is that researchers did not have an adequate amount of data from low and middle income countries to identify trends in cancer incidence over the decades. Researchers said that we aim to run more longitudinal cohort studies in the future, where we follow the same cohort of participants over the course of their lives, collecting health data, potentially from electronic health records and biospecimen at set time points. This is not only more cost-effective considering the many cancer types needed to be studied, but I believe that it will yield us more accurate insights into cancer risks for generations to come. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.